Stay with Health Matters, as the 20th of March is observed as World Oral Health Day to support the improvement of oral health worldwide. This year's theme is A Happy Mouth and is a Happy Body, underscores the importance of oral health for overall well-being. I am joined now by Dr. Nokukhanya Makwakwa, who's the Deputy Chairperson of the Medical and Dental Board. Dr. Makwakwa, a pleasure to have you on the program this afternoon. Firstly, can you elaborate on the significance of commemorating World Oral Health Day and also the collaborative efforts taking place in Gauteng to promote oral health awareness?
Afternoon, Kantla, and to the viewership. I think I need to firstly say all protocols observed since I'm speaking after the President and our Honorable Minister. Yes, you're indeed correct. On the 20th of March every year, the World Dental Federation asks the world to unite to help reduce the burden of oral diseases, which affects individuals, health systems, and economies everywhere. Now, in Gauteng, as the Health Professions Council of South Africa, we decided that we needed to have a collaborative effort with the Gauteng Department of Health universities, being Sefako Makgatho Health Science Universities, where I'm also based, the South African Dental Association, and Wits University. And we actually had an integrated program in Kagiso, where we also had school health, and we also had the environmental department of the West Rand District, education, and lastly, we also had mental health. And I'm happy that Honorable Joe Phaahla was talking about tobacco. So when you actually look at oral health and the risk factors and the causes or the etiology of it, we have common risk factors for oral conditions, and those common risk factors also are the common factors for diabetes, other general health, serious health conditions. So when we have programs, it's very important for us to integrate, because if we ensure that you have a happy mouth, then generally your whole body will be healthy. So it's quite important for us to be part of those programs, because for quite a while, I would say oral health was neglected. And I'm happy to see it going into the integrated programs.
I'm glad you raised this year's theme, of course, being Oral Health Day, being a happy mouth is a happy body. What do you believe are some of the key messages that individuals and communities should actually take away from this theme regarding the importance of oral health for overall well-being?
So I think what is important, I will just start with the basics in saying that general cleanliness, ensuring that your oral health or your mouth is clean, which would be your brushing. And also what is important is for you to actually visit your oral health practitioner. That could be your dentist, oral hygienist, or dental therapist. Because yes, largely, we actually call oral conditions or the silent epidemic, because generally 60 to 90% of the population will actually at some stage or other have an oral condition. So it is very important also, even though oral conditions are largely preventable, there are those that actually have a very high mortality and morbidity rate. So it is very important to actually see your oral health practitioner so that you can see the status of your oral condition. You have your oral cancers, you also have tumors that can be in the mouth, you have lesions that are actually associated with your HIV or other conditions. So for me, your oral health is actually the window to your soul. So it's very important for you to actually take care of your oral health, because at times you will think that maybe you just have bleeding gums, but you're not aware that those bleeding gums could be periodontal disease, which is your gum disease, which is associated with other chronic conditions like your cardiovascular disease, your heart conditions, your diabetes. So the body is really interlinked. And your oral health is also very important because, we use our mouth for a lot of things. Yes, aesthetics. You may find that if you have some conditions, you may not actually have the confidence. Oral conditions are actually quite painful. So if you take care of your mouth, you will be averting that particular pain that you will be undergoing. So it's quite important for you to see your practitioner. And I mean, I did speak about the cancers, and most of the time, I'm happy that we're talking about tobacco. Your risk factors would be your tobacco, would be your alcohol. So you actually need to make sure that you see your practitioner who will look even under your tongue and screen and detect your oral conditions early so that they can either be prevented or you can save yourself from more comprehensive treatment going forward.
Dr. Makwakwa, let's speak about the partnerships that are involved as part of this campaign. There are also these collaborative initiatives I've learned of involving dental and oral health practitioners, along with students from universities. How do you envision these initiatives actually contributing to improving oral health outcomes, especially among school learners?
So the partnerships are actually fundamental in that it's interlinked. So I'll start with the Health Professions Council. We worked with the Medical and Dental Board. As you've said, I'm the Vice Chair. We worked with the Dental Therapy Oral Hygiene Board. We also worked with the students. So what is important, because I'm a public health expert. So what is important is in the training or the curricula of our students, we need to get them involved in community engagement. So if you get them involved early on in community engagement, it means that when they now go into their private practice or they go even into the dental clinics, they're not going to practice in silos. They're going to go out into the community, ensure that they do oral health promotion, oral health education, and integrate. We're going into the national health insurance. So gone are the days where you'll just have your solo practice. We need to have an integrated system that is going to increase access for our patients and ensure that services are delivered at the point of care. So it is extremely important to have these collaborative efforts. And also what is important with our collaborative efforts is that people need to know what oral health practitioners or dentists are actually doing. Because there is a misconception that we're actually about 32 teeth. We are not about 32 teeth. Anything that is going to happen in your orofacial area actually should be referred to the dentist, because we're also finding that there are a lot of myths out there. I mean, for a case yesterday, I saw a patient who was in pain, needed to have an extraction, but then had rinsed the mouth with spirit. We have patients rinsing the mouth with petrol before they come for consultations. So we need to debunk some of those myths, and it can only happen when we actually collaborate and we use the workforce that we have to go out into communities and educate. And when we educate, it's also very important to educate children, because I can tell you now, you educate children, they go back home, they will actually educate their parents. So it is a beautiful cycle. So that is something I'm very passionate about, and it's something that we actually need to be doing more of.
Dr. Makwakwa, let me thank you so much as we conclude today's discussion with Dr. Nokukhanya Makwakwa, who's the Deputy Chairperson of the Medical and Dental Board. We've really gained valuable insights into the importance of commemorating World Oral Health Day, being that a theme this year is that a healthy mouth equals to a healthy body as well.